this video, we will be discussing some of the different screening tests available during pregnancy. Screening tests are optional and offered to everyone regardless of whether the pregnancy is considered high or low risk. These tests are typically performed through a blood draw of the pregnant person and do not increase the risk of miscarriage. Screening tests provide the likelihood that a pregnancy has certain conditions. Unlike diagnostic testing, screening tests only look for a limited number of conditions. They are not definitive, and there is a possibility for the result to be incorrect. Please keep in mind that no test or combination of tests can guarantee a healthy pregnancy outcome. But please also keep in mind that most pregnancies have no genetic conditions, regardless of how many tests are performed. The two screening tests that will be covered in this video are cell-free DNA screening, also known as NIPT, and AFP screening, as well as the possible results and next steps. Ultrasound and carrier screening are also considered types of screening tests. Please watch the additional videos in this series for more detail about each of these. One of the more common screening tests you'll be offered during pregnancy is called cell-free DNA screening. Cell-free DNA screening may be referred to by many other names, including cfDNA, non-invasive prenatal testing, or NIPT, and non-invasive prenatal screening, or NIPS. Each testing company will have their own brand name for this test as well. Cell-free DNA screening is performed on a blood sample provided by the pregnant person. During pregnancy, small fragments of DNA from the placenta are present in the pregnant person's bloodstream, and cell-free DNA screening will predict whether that amount is within the expected range. Cell-free DNA screening can screen for the most common chromosome conditions that babies are born with, which are Down syndrome, trisomy 18, trisomy 13, and X and Y chromosome variations. Some versions of this test may also include screening for other conditions, including certain microdeletions. Cell-free DNA screening can also predict the sex of the fetus. Another common screening test is AFP screening, which may also be called MSAFP screening. AFP screening looks for the amount of protein, called alpha-fetoprotein, or AFP, present in the bloodstream of a pregnant person, which tends to be elevated when a pregnancy has certain birth defects, like open neural tube defects or abdominal wall defects. The two possible results from these screenings are screen negative and screen positive. Screen negative means that the likelihood that the fetus has any of the conditions included in the testing is very low. Since screening tests are not definitive, there is a small chance for a false negative result with any screening. This means that there is still a small chance that the fetus has one of the conditions included in the testing, even though the results are screen negative. Some patients with low-risk results may still elect diagnostic testing for more definitive answers than screening tests can provide, or to test for conditions beyond what can be looked for with the current screening tests. Screen positive means that the likelihood that the fetus has a condition is increased. In this case, the results will be specific about which condition the fetus is screen positive for. Since screening tests are not definitive, there is a chance for a false positive result with any screening. This means that the fetus may not have the genetic condition even though the results are screen positive. We always note that no irreversible actions, such as pregnancy termination, should be taken based upon a screen-positive result alone. When results are screen-positive, patients will be offered the option of follow-up diagnostic testing for more definitive answers to either diagnose a condition or rule it out. We hope that this video has been valuable and informative. Please watch the additional videos in this series for more detail about various aspects of genetic conditions and pregnancy. If you feel it would help to discuss the conditions or tests in more detail beyond the scope of these videos, please speak with your medical provider or request a referral for genetic counseling. Warmest wishes on your pregnancy journey.